Lovely. Good evening, folks. Sorry, let's get started. So I hope you're able to see my presentation. So the aim this evening is for me to take you through the presentation. We have a question answer session going alongside. My colleague Jackie McAdams is on the question answer and she'll be taking the questions alongside. So please don't wait till the end. Keep posting your questions. There is a link provided for you to have a virtual tour of the clinic at the end of the presentation. Please do stay with us till the end and I will reveal a special discount that the clinic is offering. And there is also a link provided for all of you to give us a little feedback because, you know, this is precious. All these feedbacks do go into making these evenings better. So once again, welcome and thank you very much for taking out the time. The entire team, Jackie, myself and Mana, wish you a fantastic 2024. My name is Praveen Pai. I'm the consultant gynecologist and fertility specialist. So a little bit of the history. We were founded as the Essex Fertility Centre in 1989. We've got over 34 years of experience with more than 5,000 babies created. All procedures are performed under one roof and we've got this beautiful state-of-the-art purpose-built clinic. So all the needs being met under one roof is one of the big advantages. What are the services we provide? So we've got fertility assessments. We do treatments which include IUI, IVF, ICSI, PICSI. We lay a lot of emphasis on fertility preservation, be it egg freezing, sperm freezing. We are doing a lot of egg donation, sperm donation cycles. We are one of the leading clinics for surrogacy treatment. Apart from these, we also do pregnancy scans and the NIPT, which is the non-invasive prenatal testing for Down syndrome and other chromosomal anomalies. It was earlier called Harmony test. And this could be as a part of the treatment cycle, somebody's become pregnant, or even standalone pregnancy scans up until 10 weeks. We offer gynecological assessments and additional treatments like pre-implantation genetic testing. So I'm just going to take you through some of these a bit more in detail. Fertility assessment. So it could be the female fertility assessment or the male fertility assessment. Female would include bloods, a pelvic scan, which is a 3D scan, followed in the same sitting with a consultation with the consultant. Male fertility assessment includes the semen analysis and a chat with the embryologist. What kind of pelvic scans do we offer? So we do a 2D followed by a 3D scan in the same sitting. And whilst we're doing that, we can insert a little bit of saline into the cavity. This is known as saline infusion sonogram or CIS, which gives us a good look into the womb and occasionally pick up a polyp or a fibroid, which ought not to be there and needs to be sorted before we can start a treatment cycle. Equally, in the same sitting, we can do a high COSI, which means we now put a dye through the neck of the womb and see if it's spilling through one or both the tubes. And that way we establish that the tubes are working properly because that's what's needed if somebody's going to try an IUI cycle. And as I said, should we pick up things like fibroids or polyps, then we might send you down the reproductive surgery route. We've got the ability to offer you surgery as well privately, or we can refer you to the NHS. But if not, it could lead on to a fuller consultation. So what happens is essentially it's the 3 steps. Sorry about the busy slide. So if somebody books a consultation, then you're looking at doing consents online. You are, both the partners are invited for a pre-assessment with a nurse in which she will look at your weight, height, BMI. If bloods haven't been done, if semen analysis hasn't been performed, then that is done at the same sitting. And finally, there is a consultation through Microsoft Teams, a good hour-long consultation in which the consultant will make a sort of bespoke plan for you based on all your sort of parameters, blood tests, semen analysis, etc. We have this wonderful app called Salve app, which we get you to download. And this works really well as a medication manager, as an appointment reminder. You can talk to us, no matter what time of the day, and you can get some reassuring advice via Salve. Fit for fertility, I can't emphasize this enough. Before any kind of treatment begins, we make sure that we, you've got a healthy diet, a healthy BMI, and because the aim is not just to get you pregnant, but also to ensure that you commence and have a wonderful pregnancy journey, a safe pregnancy journey. So once we've done the consultation, before the treatment begins, there are certain bloods that need to be done from the welfare of child point of view. So both the partners are brought in for screening bloods, which include bloods such as HIV, Hep B, Hep C, chlamydia, gonorrhea. Additional screening for female would include rubella, a full blood count, electrophoresis to pick up things like sickle cell or thalassemia. It's important that we do these bloods as close to the commencement of treatment because they must be within 3 months of the egg collection. And we'll give you information about that as we go along. So what are the kind of treatments that we offer? So first and foremost, or the least invasive, shall I say, is the intrauterine insemination. The aim of an IUI is to deposit the best quality sperms directly into the womb. Okay, IUI is IUI helps in creating pregnancies in only a certain subset of couples. So if it's a heterosexual couple with psychosexual problems or female vaginismus or males having impotence, severe premature ejaculation, erectile dysfunction, anything that comes in the way of having an effective sexual intercourse, okay, that would then qualify as a couple for IUI. Similarly, if you've got single women who would like to use donor sperms, then IUI is a good first step. Or if we have a female same-sex couple who would like to use donor sperms, then IUI becomes a first good step. I often get asked to speak a little bit more about IUI because I think people want to try something a little less invasive than an IVF. I guess I can understand that. So in an IUI, what one needs to understand is that when the consultant speaks to you, he or she will, have a good look at the entire set of notes to see, the age, are we, meeting the criteria to be able to give us a good shot at pregnancy through this procedure, because we know that the success rates with IUI of giving us a live birth are about 8 to 10%. So the younger the couple is, the better it gets, the more normal the ovarian reserve. And of course, we have to establish that there is tubal patency, which means, we should have had at least a high COSI or an HSG on the NHS to make sure one, if not both, the tubes are working. So that's about IUI. Moving on to the next step could be an IVF or an ICSI cycle. IVF stands for in vitro fertilization. ICSI stands for intracytoplasmic sperm injection. So the first path for both of them is the same. We break it down into IVF or ICSI based on what we do with the eggs which are collected and how are we going to then fertilize them. Are we going to just leave each egg, surrounded by a few million sperms and leave them and check how many of these have fertilized 24 hours later? That's IVF for you. If the sperm parameters are not meeting the strict lab criteria, then the embryologist would like to select the best sperm under the microscope and inject each mature egg with a sperm, and that bit is known as ICSI. So no matter what plan has been made for you, how do we start? So we start with a baseline scan. The nurse will see you and she's going to teach the female to inject these hormonal injections on a daily basis into her belly. And this is to stimulate the ovaries and encourage the follicles to grow. This regime of injections continues for about 10 to 12 days. So that is up until 2 days prior to the egg collection. Vast majority of women will tolerate these injections quite well. There are some side effects like headaches, mood swings, breast tenderness, bloating, and in a very, very small percentage, particularly in women who've got polycystic ovarian syndrome, who've got very high AMH, there is a tiny risk of OHSS called ovarian hyperstimulation syndrome. So what happens is, let's say we've started you on medications, we give you 5 days worth of medications you purchase from the pharmacy, do the injections, we bring you back for a check scan. If you find that the eggs are growing well, so the follicles is what we call them technically, are growing well, so you're responding well, then we introduce one more injection in the morning. Now this injection is called an antagonist, cetrotide, for example, and that is to prevent you from ovulating prematurely. So the injections in the evenings continue, the injection in the morning begins. We continue monitoring your cycle by doing a couple more scans, and each scan is followed by a consultation with the nurse, who would then sit down with you, make sure you've got, a hang of the injections, and she'll take, any queries, any problems associated with the injections. The final scan will determine the date and the time of the egg collection. We, once, let's say today we've done the final scan, we place you for a trigger injection, either with an HCG or GnRH analog. Tonight, say 10 p.m., approximately 36 hours later, that is 10 a.m., day after tomorrow morning, you are invited for an egg collection, okay? And you'll be given detailed verbal and written instructions on how to do that. Egg collection, when you come in, both of you are admitted to the recovery bay. We do the baseline observations. The male partner goes away to provide us with a fresh semen sample. You get a chance to meet the anaesthetist. We take you inside the operation theatre. You're given deep sedation, so you're knocked out and have a lovely little sleep whilst the surgeon goes and does egg collection transvaginally, like all the other scans. Once the procedure is completed, you're brought back into the recovery. Once you've had a nice cup of tea, you've come out of the anesthetic effect, you've emptied your bladder, the surgeon will come and have a chat with you, tell you what is the egg number, and then we let you go home. So you're in the clinic for about 3 hours or so. So if you want to see this in a slide, the way it works, let's say you get a period here. We bring you for a baseline scan around day 3. That's when your first scan happens. We commence injections. Approximately on scan 2, which is about 5 or 6 days later, we commence the morning injection, that is to prevent you from ovulating prematurely. Evening injections continue. We bring you to the third scan, and at this scan, let's say we find everything is looking perfect, good sized follicles, ready for trigger. You're given the trigger. 36 hours later, you come in for the egg collection, right? Once the egg collection is done, if the plan is for a fresh transfer, you will commence what is known as the progesterone supplements, the pessaries. And then approximately 5 days later, which is the blastocyst stage, you come in for the embryo transfer. And then approximately 2 weeks later, we advise you about the pregnancy test that you'll be doing on your first catch urine sample. Excuse me. So as I said, the treatment cycles could be IVF, ICSI, both of these I've already mentioned, or it could even be PICSI. So what our lab does, we do an additional test when we are looking at the semen parameters and test the sperms for maturity. If the so this test is known as HBA, hyaluron binding assay. And if the hyaluron binding assay is suggesting that we've got more immature sperms, then we use a special technique to try and select the best quality, most mature sperms, and then inject them into the eggs. So the P stands for the physiological intracytoplasmic sperm injection, whereby we are selecting the best looking, motile, mature sperms and injecting them into the eggs. So whichever way we take, what we want to see 24 hours later after the fertilization has taken place, this beautiful picture of 2 pronuclei, okay? And then on day 3, we want to see this cleavage embryos. Of course, if we are heading for a blastocyst, we do not go and disturb these embryos, okay? We leave them in an undisturbed culture, but that's how a day 3 embryo should look, like a nice 8 cell. The cells continue to multiply, and eventually on day 5, we should see this lovely textbook picture, which is a blastocyst. So this is a little clump of cells. We call this inner cell mass, which is going to form the baby. And this single layer of cells all around, which is called the trophoectoderm, which is going to form the placenta. Okay, and this is the kind of picture you get to see when you come in for the embryo transfer. Sometimes you might, it might have even gone a stage ahead where it is starting to hatch. That means it's very ready to, and raring to get into your womb and start the implantation process. Again, a lovely picture to see on the day of the embryo transfer. Right, so comes the day of embryo transfer. The Day of embryo transfer will be based on the number of fertilized eggs. So what that means is if we get to a point of having 3 or more fertilized 24 hours after the egg collection, we want to leave them so that the strongest one gets selected and reaches the blastocyst stage. And that's the one we want to put back into your womb. If the fertilization rate is any less, maybe 1 or 2, then we bring you in earlier and do a day 3 transfer. Okay. Embryo transfers in our clinic, the beauty is, we offer them 7 days a week, which maximizes your chances of pregnancy. You will be given an opportunity to see your embryos on the screen, and you'll also have a lovely picture to take away. Embryo glue is an add-on that our clinic offers. It's a transfer medium which mimics the conditions in the female uterus, and there are lots of studies now supporting the use of embryo glue because it's said to improve the implantation rates. As I mentioned earlier, we also do something called pre-implantation genetic testing of embryos. So the success. Now, we all know that an IVF or an ICSI cycle, if all conditions are fine, female age is 35 or under, semen parameters are lovely, ovarian reserve is normal, then the chances of live birth in one cycle is 35 to 40%. But that success predominantly boils down to the chromosomal normality of the embryo, of the blastocyst. And how do we judge that? The only way we can find that out is by actually biopsying the blastocyst, as you can see in this picture, getting it analyzed in a special laboratory, and then selecting only the chromosomally normal embryos to transfer. And this procedure is known as PGTA. A stands for aneuploidy. So pre-implantation genetic testing of the blastocyst for aneuploidy, that is chromosomal abnormality. Okay. This technology also allows us to screen for monogenic diseases like cystic fibrosis. So if there's a couple who's got cystic fibrosis and are keen to avoid that in their offspring, then that is something we can offer. Similarly, there could be couples, especially seen in females with recurrent pregnancy losses, recurrent miscarriages. If they find during the investigations that one or the other has got problems in their chromosomal milieu, something called unbalanced translocation, then we can offer something called PGT-SR for those embryos. So that's about the pre-implantation genetic testing. IVF fitness system, and this is something you might have heard. So this is a technology that we use in our laboratory to make sure that there is an absolutely robust system to match the correct sperms, correct eggs, correct embryos with the correct patient. Okay, so patients are given an ID card at the beginning of their treatment cycle from egg collection to embryo transfer. Sperm, eggs, embryos, everything which is there in the dish is electronically tagged. So this witnessing system essentially provides traceability of all lab procedures. Procedures are carried out in designated witnessing stations, providing further patient reassurance. So that's one of the highlights of our clinic, that IVF witnessing system has been with us and has given all of us peace of mind, and we pass on that peace of mind to our couples as well. Yes, and what one hopes is at the end of whichever route you've taken, be it IUI, IVF, ICSI, PICSI, we get to a stage where we have this beautiful pregnancy. So we do offer early pregnancy scans at 7 weeks, and the idea is to establish, is this pregnancy a nice, viable pregnancy in the right place? And once we've seen that, then we kind of say goodbye to you and ask you to book your further care with the NHS. But we also have the ability to offer you a 10-week scan along with the NIPT, as I mentioned earlier, which is a blood test to look at a couple of chromosomal abnormalities like Down syndrome, Patau syndrome, Edwards syndrome. And you also have the ability to actually, via this test, if you choose to, know the gender of the baby. So that's about a beautiful culmination of a cycle into a nice pregnancy. Moving on, we also offer donation treatment. So we've got egg donation, we've got sperm donation. Egg donation might be needed if there is, a partner or a lady who comes and finds that her ovarian reserve has dwindled to almost nothing, and she needs to borrow eggs from a younger counterpart. Someone who's gone through early menopause, someone who's lost the ability to produce eggs because of chemotherapy. Some individuals are born without ovaries, and of course, when a couple comes to us, especially male same-sex couple I'm talking about, they need to get donated eggs and then use them to create embryos and then transfer them into a surrogacy. So it very much is a part of a surrogacy cycle. Similarly, sperm donation, if there's a male who is unable to produce sperms, either because of an endocrinological problem, it could be because of the chemotherapeutic agents or genetic disorders, because of which the testes are not undergoing or producing the sperms. It could be a single lady who wants to use donor sperms to have either an IUI or an ICSI cycle. And equally, the same thing applies if we've got a same-sex female couple using donor sperms. Surrogacy, as I mentioned, we were one of the pioneering clinics as far as surrogacy is concerned, and I'm told we're one of the leading clinics in terms of the number of surrogacy cycles that are offered in the UK. What is surrogacy? Essentially, when someone agrees to become pregnant and have a baby for someone else. Okay, so there are two parties involved. There is a surrogate who is this one here, who is who's willing to carry the pregnancy, and then we've got the two intended parents. Often the only option for women unable to carry a baby to term, and of course in male same-sex couples. This could be, if you're talking about women, this could be somebody who's born without a womb, or it could be somebody where, she's got a womb all right, but she's probably got some medical conditions whereby she herself becoming pregnant could be life-threatening to her. So the two types of surrogacy we have, we've got a full or host surrogacy, which is predominantly what is offered, and then the partial and straight surrogacy. Right. So how about what kind of funding options and where are we sort of getting our couples from? So we have got a contract with the NHS, with the Mid and South Essex Integrated Care Boards, okay, and also with the North Central London ICBs. So if you happen to feel that you are eligible for NHS funding and our clinic is something that appeals to you, please have a look and see if you could get referred to us via the NHS pathway. And for those who have no NHS funding, we've got some other options available. So we do have programs like the egg share program, the sperm share, and the freeze and share, whereby, to give you an example, let's say we've got somebody who is young. So there are certain criteria which need to be met. So for example, if I've got a lady who would like to do her own cycle, but equally egg share, then we have to make sure that you qualify, you're young, you've got adequate ovarian reserve. So we do a few sort of pre-assessments, and then if all is well, then we take you through a cycle whereby we stimulate you, get the eggs out, create the embryos, and give you a pregnancy, an IVF cycle. But your costs get significantly subsidized because now you're sharing whatever number of eggs we get. Half go to you and half go to the egg bank. So we've got options similarly with sperm share and freeze and share. So I'm going to talk you through egg freezing, because that's been in the conversation for quite a few years now. You can see, and even today you can read a lot of articles coming up, dramatic rise in number of women freezing eggs in the UK. Is this hope or hype? The chilling truth about freezing your eggs. So why are we finding that egg freezing has, slowly starting to creep into our normal conversations? Why are more women freezing eggs? So we looked at the HFEA data. We found that in COVID, during the pandemic, the egg freezing, overall, there was an increase in embryo freezing as well as egg freezing. And when they delved a bit deeper as to the reasons, I think one of the foremost reasons is that women are better informed about their fertility, the age-related decline in fertility, and what are the options available to try and preserve that fertility. From our side, we're finding that there's improved freezing technology. It's a process called vitrification, which compared to the slow freezing that we used to do, with vitrification, we've got better thaw survival rates, consequently, better ability of these eggs to give us a live birth. Okay, so that's why egg freezing is becoming a more efficient process, if you like. Also, what has been a good change, or rather a good a change is a change in law, which now allows, earlier it used to be if somebody's freezing their eggs and they can freeze them up to 10 years, but now that has been extended up to 55 years. So I think that's a very positive change which has come through HFEA. And then, of course, all this that I talked about is about social egg freezing. There are those women who have to freeze eggs because of medical reasons. For example, if they've been diagnosed with cancer and they are undergoing chemotherapy, so before the chemotherapy therapy sort of knocks out the ability of the ovaries, it's prudent to freeze their eggs. So, egg freezing is a reproductive technique to preserve fertility. Frozen eggs are stored in liquid nitrogen, and now we can go up to 55 years. Success rates, as I said, because of the advanced technology of vitrification, success rates have become increasingly good. The quality of eggs. So the most important thing, which I think I want to get across, is the younger you are, the better the ability of these eggs to give us a live birth. And I've got a couple of slides on that. Egg freezing could be because of social reasons, could be because of medical reasons, could be menopause, cancer, and before any egg freeze cycle, it's important for us to assess the ovarian reserve, and we do that with the help of a blood test called AMH and also a transvaginal scan to look at your antral follicle count. Right, so when we look at where are we getting all that data, how are we being informed about, egg freezing, what is a good number? And you might have come across a number 20 being mentioned. It's a good number to freeze your eggs is 20 mature eggs. So where did that number come from? So this was one of the landmark papers from Doyle et al. So in this study, what they have done is they have taken 1,283 frozen eggs. They have thawed them, warmed them, and then utilized them in 128 IVF cycles. And what they found, so if you look at the blue line here, that is the predicted probability of having at least one child. Okay, red line is having at least 2 children, and green line tells us about the ability to have at least 3 children. That's the predicted probability. Okay, so if you look at the mark, so let us say this is the number of mature oocytes. Okay, so if somebody has, when we have women freezing their eggs between the age of 30 and 34, if they have frozen 20 eggs, okay, they have, if you follow my arrow, they have close to 80 to 85% chance of having one live birth. So if you now follow the same thing, come to 41 to 42-year-olds, 20 frozen eggs, the likelihood of getting a live birth, you're looking at about 35 to 40%. So that's what I meant. The younger one is, the better the quality of eggs, the better the ability of these eggs to survive the thaw, and better the chances of getting a live birth out of those. Okay, so when they looked at this study, what they found was they per egg to newborn, what was the conversion rate? So in a 30 to 34-year-old age group, for every egg that was frozen, there was an 8.2% chance of getting to a newborn. Okay, and the percentage keeps dropping till we reach the age of 41 to 42. It drops down to about 2.5%. I do hope that makes sense. Okay, so another study, and this was a modeling study from Goldman et al. And what they essentially are saying the same thing. So live birth predictions by age and number of mature oocytes. Oocytes are eggs retrieved. Okay, if you look at this figure 20, and if you follow this, so this we are looking at 42-year-olds. Look at the orange line. So if a 42-year-old has frozen 20 eggs, okay, she has a 37% chance of having a single live birth. But the same thing, if you look at this line, this orange line up here, which is the less than 35-year-olds, okay, less than 35-year-olds freezing 20 eggs have a 90% chance of having a live birth. So this is what I meant by age and egg freezing. So that is why this kind of brings me to our campaign that we have established called My Eggs, My Future. All right. So My Eggs, My Future was a campaign that we launched in September 2023, and it's going strong. We felt the need because too many women who came for treatment came when it's too late. And, I often heard women saying, I wish I knew earlier. So the purpose was to educate people about the lifespan of their fertility, to tell them about the fertility preservation options, to talk about egg freezing so that they could make informed decisions. Target audience was people in their 20s and 30s. Okay, desired outcome is with the NEMF. We are hoping people get talking, people get sharing, okay, and come forward to try and freeze their eggs and get control of the parenthood, if you like. So the long-term goal with this is more egg freezing, more families, less childlessness, less regret. So if you want to go and have a read, we've got lots more information on www.myeggsmyfuture.com. And on the website, you will come across this story of Kira. Kira was my colleague. She worked here, young, enthusiastic, and just on a whim, she decided to test her AMH, and much to her horror, she found her AMH was in single digit, quite low for her age. Bless her. The initial shock then turned to what can I do about it? And then the clinic, of course, supported her in going through egg freeze cycles, and now she's much happier knowing that she's got something in the kitty, when she decides to become a mum. So how does the egg freezing process work? Just call and book. We bring you in for fertility assessment. As I said, we need to do your ovarian reserve testing. So we do it via a blood test called AMH. We also bring you for a pelvic scan to look at the antral follicle count. Then follows a full consultation with one of the consultants. Once we decide that that's what is going to happen for you, then we bring you forward for the screening bloods. There's a TIA in which one of the nurses will sit down with you and she'll go through all the legal documents, the consents, and then we take you through a process of hormonal injections, that is the ovarian stimulation, collect the eggs, see how many of these are mature, and these then get frozen for you. So if you look at the fertility treatment costs, we've got costs, expressed for IUI, IVF, ICSI, PICSI, everything. But if you look at the egg freeze, for example, you've got 3,900 is the cost per cycle. But because we know that we are trying to sort of get to that 20 mark, which might not happen in one cycle alone, we've also got a 3-cycle package. So that kind of brings me to the end of this presentation. So this was a New Year special offer that I was reminded I should reveal at the end. So what we have decided is all patients, as you know, need an AMH. AMH cost otherwise is £125. But if you were to book your initial consultation by 31st of January, that will be waived off. So you will get AMH free of cost. So as I said, this is open till 31st of January. Before I close, I must mention, so sometimes couples come to us saying that, look, I don't think I rate my chances very, very high. I think I probably will end up requiring packages. I'm looking maybe 2 or 3 cycles. So we've partnered. So we've got Access Fertility as a partner. So they work with various clinics in the country. So they are the ones who are able to offer you packages. They've got 3, I think they've got IVF Unlimited, IVF Refund, and IVF Multi-Cycle. So if you feel, no, I don't think I want just the 1 cycle, I want to look at packages, please go and have a look at the information provided by Access before you commence the treatment journey. And last but not the least, the journey to parenthood can become quite stressful and lonely at times. And I think we all understand that really well. So you'll never find you're alone on this journey in this clinic. Okay, we take emotional support during this journey extremely seriously. Talk to us. You talk to us face to face. You can pick up the phone and talk to us. You salve messages to us, not a problem. But apart from this, if you want to speak to somebody outside the clinic, you get up to 3 supportive counseling sessions free along with your treatment cycle. So why us? I hope I've been able to convince you that we are a good unit. So we've got over 34 years of experience, 7 days a week lab services. We've got the electronic witnessing system for safe delivery. Over 7,000 babies. You will have support throughout your treatment, and it's a beautiful location. We've got a beautiful canal and a free car park. So we value your feedback. This is really my last couple of slides. There is a link which Mana has sent you, a short survey through SurveyMonkey. Please do take time and leave us a little feedback, because what you tell us goes into improving these presentations. You can stay connected with us on social media channels. We've got a few of these, so do have a look. If you want to book an appointment, you've got the number, we've got the enquiries line, and looking at the diary, I think we should be able to offer you a new consultation within a couple of weeks. You've got a link for the virtual tour of our clinic. Please have a look at that. It gives you a little feel. We're more than happy if you want to drop in, just call us, drop in, and actually want to go around the clinic. We'll be more than delighted to take you through. And that brings me to the very end. Thank you very much. I do hope you've been sending us questions. But once again, I wish you all a fantastic 2024 from the entire team of Herts Essex Fertility. Wish you all a lovely evening. Bye.